This episode of Fertile Talks is sponsored by ilmeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ilmeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. My name is Dr. Famuyiwa. I'm the medical director and founder for Montgomery Fertility Center. I'm also a clinical assistant professor at George Washington University Medical School and also the founder and host of Fertile Talks with Dr. Famuyiwa podcast. Fertility is the ability to reproduce, the ability to conceive when you want to. Infertility is the lack thereof, right? The inability or difficulty encountered or with trying to reproduce. Lifestyle factors has to do with dieting and what people consume. Nowadays, some people imbibe in alcohol. Smoking is definitely not good. And I think one of the recent things that we're finding out, because more and more people are imbibing in marijuana and medical marijuana, and that has been shown to be an endocrine disruptor and to affect fertility as well, and also can result in poor sperm outlook. Other than that, environmental issues, what you expose your body to. So I always tell my patients, what are you exposing your body to? Because there are a lot of chemicals sometimes in food, sometimes in makeup, sometimes in things that you don't even think about. For some patients, they may store hot food in plastics and you leach microplastics into your food, and those are not very helpful. So, the key question is what your body exposed to, what habits do you have, and what kind of food are you consuming. Well, really, infertility is described as the inability to conceive after having a full year of unprotected intercourse for patients who are younger than 35, and for people who are older than 35, that will be after 6 months. However, I do say that for some patients who may have other issues, they may not want to wait that full year. So, if patients have fibroids or endometriosis or polycystic ovary syndrome, you probably don't want to wait a whole year to figure out that it's not working, because you may need other intervention at an earlier stage. So when patients call, seeking fertility help, the first thing I do is you want to gather data. You want to see what's going on with their hormones. So we can check their hormones on the first, second, third day of the menstrual cycle. I also like to investigate the uterus. I have this here. You want to make sure that, the tubes are open, the uterus is normal. Do you have anything obstructing the uterus there? Those are basic information. And then you want to check 50% of fertility, after all, is male. So you want a semen analysis, initially to make sure there's no sperm issue. So that's just your basic, very extremely basic workup. And from there, you can start to escalate and troubleshoot more. Well, so, everybody, I don't know that there's a best treatment per se. I think you have to tailor your management to people. I remember one of my patients, we went over her lifestyle habits. We did a review of her dietary patterns. And I laid out, we came up with a plan to sort of clean up, if you will, her lifestyle, which she adhered to. So in terms of improving her diet, in terms of increasing the vegetable content in her diet, nuts, berries, fruits, more fiber in her diet, and then making sure that she, is well hydrated and getting adequate sleep. Most people don't even know that sleep can be medicine, right? And then I tell them, go out and move your body a little bit. They now recommend at least 150 minutes per week, but you can do 15 to 20 minutes. Just go for a walk. You don't have to break any Olympic record. So we were able to just work with her lifestyle, right? And lo and behold, she called me a few months later and she was pregnant. So you can start with something basic as that. So, you want to talk to the patient, know your patient, and come up with what's going on in their life. I've had other patients that were extremely anxious, had other medical problems. So working with a psychiatrist or a psychologist, getting them some counseling, was able to improve their stress level. It helped them. So when you look at the individual, I always say you want to tailor the plan to what's going on with them. Right? So when you look at all those extra things, you may decide, okay, do you want to intervene in what, and then you have to decide in what way. What would you intervene with? Is the sperm good? If the sperm's not good, what do you need to do to improve that? Do they need a full male workup? If the sperm's good and everything is good, do you start with basic timed intercourse, or do you try artificial insemination? So, and then if that doesn't work, you can escalate it to that. So it really depends on what's going on with the patient. So PCOS is a global issue. It affects 8 to 13% of women worldwide. And part of it could be hereditary, part of it could be environmental, right? We do know that PCO patients may have diabetes in their family background, for instance. Those people have a high incidence of diabetes in the future. It could be lifestyle. It could be rapid weight gain that affects them and can cause that. But you also want to know that other issues that are PCOS-like problems have been evaluated. So you want to evaluate for, is it a congenital adrenal hyperplasia? Is their prolactin normal? Is their thyroid functioning normal? Because there could be other things that mimic a PCOS symptom. And then you want to use evidence-based guidelines to make the diagnosis. We used to use the Rotterdam criteria, which says 2 out of 3 criteria have to be met, meaning they have poor ovulation, excess androgen, and probably a polycystic morphology on the ultrasound. But that was modified in 2018, so we know now in teenagers the ultrasound criteria doesn't hold, because teenagers may have multicystic ovaries, right? They're still establishing their regular pattern. So you can't use that criteria if they're less than 8 years after menarche, which when they start their period starts. So other patients, you use that criteria, look at they have to meet 2, not all 3. So the ovaries don't have to have anything. If they're not ovulating and they have evidence of excess androgens, then they meet the criteria. Yeah. Okay. So the first thing you want to look at lifestyle, because the lifestyle, not only PCO patients, they have an advantage of they have a lot of good reserve, but that doesn't mean the egg quality may stay the same. So you want to look at what is in your diet. We talked about it. If they're overweight, they want to lose even 5 to 10% weight loss can be very helpful. The lean PCO patients, those are the ones that are normal weight, but there's nothing to lose. Do you look at their diet pattern? What can they do about that? And getting adequate sleep and exercise can be very helpful. Reducing stress. So some patients, they benefit from meditation, prayer, yoga, acupuncture. Anything they can use to reduce stress will be helpful. So I think that anyone who has a vision that one day they may want to conceive or have children using their own genes, it should be in the background of your thoughts, even in your 20s, 30s. You start paying attention to what you do with your body and what other disease processes are going on. But a good way to start is to simply talk to your gynecologist or your primary care doctor and start, going over things that may affect you, right? So they can look for us at Montgomery Fertility Center, and they can email us at faqmfc@gmail.com. Okay? All right, no problem. All right. Okay, thank you. All right, take care. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.